Have you ever wondered why sometimes breathing, a fundamental life process, becomes a struggle for some people? Today, we delve into a topic that touches millions of lives worldwide: asthma, a condition that transforms the simple act of breathing into a daily battle. Asthma is not just prevalent, it's a significant concern for many. It's more than just a word or a diagnosis. It's a reality that affects a person's quality of life. This video is all about understanding this condition known as asthma. Asthma is more than just a word. It's a chronic disease that affects millions of people around the world. Asthma is a condition where your airways narrow and swell, producing extra mucus. This leads to difficulty in breathing, which can range from being a minor nuisance to a major issue interfering with daily activities and could even lead to a life-threatening situation. To understand how asthma affects us, let's take a brief detour to understand how our respiratory system works. Imagine a tree upside down. The trunk is our windpipe or trachea, and the branches are the bronchial tubes. These bronchial tubes further split into smaller tubes called bronchioles, ending in tiny air sacs named alveoli. Now, when we breathe in, air travels down the windpipe, through the bronchial tubes, and finally reaches the alveoli, where the oxygen is absorbed into our bloodstream. In individuals with asthma, this journey of air isn't as smooth. The bronchial tubes become inflamed and sensitive. They tend to react strongly to certain inhaled substances. When the bronchial tubes react, the muscles around them tighten, narrowing the tubes and allowing less air to flow into the lungs. The swelling can worsen, making the bronchial tubes even narrower. Additionally, cells in the bronchial tubes might make more mucus than usual, which further narrows the tubes. Asthma is a chronic condition. This means it's a long-term disease that requires continuous management. It doesn't mean, however, that people with asthma can't lead a normal, healthy life. With the right treatment plan, individuals can control the symptoms and prevent asthma attacks. So asthma is not just about the difficulty in breathing. It's about how our body reacts, how our bronchial tubes respond to triggers, and how well we manage these reactions. It's a complex interplay of multiple factors, each playing a significant role in the overall condition of an individual. So asthma isn't just about difficulty in breathing, it's a complex interplay of multiple factors. Now that we know what asthma is, the question arises: what causes it? Well, the answer isn't as straightforward as one might think. Asthma is a complex condition, and its causes can be multifaceted, often intertwining genetic predisposition with environmental factors. Let's start with genetics. There's a significant link between asthma and heredity. If one of your parents has the condition, it's more likely you'll have it too. But genetics alone doesn't explain everything. Enter environmental factors. Asthma can be triggered by a wide array of environmental elements such as pollution, dust mites, and even certain foods. But the story doesn't end there. Specific triggers, often unique to each individual, can also prompt an asthma attack. These can include allergens like pollen or pet dander, cold air, and even exercise. The interplay between these factors is what makes asthma such a complex and individualized condition. Understanding these causes helps us manage and potentially prevent asthma attacks. Recognizing asthma can be the first step towards managing it. Just like solving a puzzle, we need to know what pieces we're working with. In the case of asthma, these pieces are the symptoms. At the forefront, we have wheezing. This is a high-pitched whistling sound that comes out when you breathe. It's like your lungs are trying to play a tune, but it's one tune you don't want to hear. Next up, we have shortness of breath. This is a feeling of not getting enough air, as if you're constantly running up a flight of stairs. It's as if you're in an invisible race, but you're not quite sure where the finish line is. Then there's chest tightness. It feels like an unseen force is squeezing your chest, making it difficult for you to breathe. It's like wearing a tight corset, except you can't just take it off when it gets uncomfortable. Lastly, we have coughing. This isn't your regular run-of-the-mill cough. It's persistent, especially at night or early in the morning, making it hard for you to get a good night's rest. But remember, symptoms can vary from person to person. They might not be present all the time, and sometimes they might be so mild that you barely notice them. Other times, they could be severe enough to disrupt your daily activities. The key lies in being attentive to these signs. Early recognition of these symptoms can lead to better management of asthma. After all, knowledge is the first step towards empowerment. So, how do we treat asthma? Well, there's no one-size-fits-all answer to this, but let's dive into some common methods. Inhalers are often the first line of defense. They deliver medicine directly to the lungs, providing quick relief during an asthma attack. Nebulizers, on the other hand, are machines that turn liquid medicine into a mist, making it easier to inhale. Long-term control medicines are also an invaluable tool in the fight against asthma. These medicines reduce inflammation and help prevent asthma attacks from happening in the first place. But remember, everyone's asthma is unique, which is why personalized treatment plans are so important. Working closely with healthcare providers to identify triggers, monitor symptoms, and adjust treatments as needed is crucial. Regular checkups allow for this kind of fine-tuning, ensuring the treatment plan stays effective. While asthma can't be cured, it can certainly be managed with the right treatment. So take heart and take control, because living well with asthma is entirely possible. To recap, we've covered a lot about asthma today. We began our journey by decoding what asthma really is. Remember, it's a chronic disease that affects the airways in our lungs, making it difficult to breathe. We then delved into the myriad causes of asthma, from allergens like dust and pollen to irritants like cigarette smoke and air pollution. There are numerous triggers that can lead to an asthma attack. Next, we moved on to recognizing the symptoms of asthma. Coughing, wheezing, shortness of breath, and chest tightness are telltale signs that should not be ignored. Finally, we explored various treatments for asthma. Though there's no cure, with the right medication and preventive measures, asthma can be managed effectively. It's important to remember that knowledge is power. The more we understand about asthma, the better equipped we'll be to handle it. Remember, understanding asthma is the first step towards managing it. Stay informed, stay